Hey everyone, I think I've seen most of you before. If I haven't met you, my name is Michael Schwartz. I'm the VP of Experiential for Better Spaces. We partner with buildings and companies to create programs that help you connect, create, and perform at your highest potential. Today's session with Dr. Paul Kachowa is 3 tricks to help your tight lower back. Dr. Paul Kachowa received his doctorate of physical therapy from Mercy College, is a BS in exercise physiology from Rutgers. His treatment philosophy is move better, feel better, and play better. To learn more about PAR5 Physical Therapy, you can go to par5pt.com. And if you have any questions, feel free to put them in the chat window or at the end of this session, raise your hand and we'll have a little time for Q&A at the end. Okay, Dr. Paul, thanks so much.
Awesome. Thank you, Michael, for the intro. Let's get started. So we're going to go over some secrets, 3 secrets and 3 tricks, basically to help a tight lower back. Let me pull up my slides here, get rid of my lower third, and let's get this started. Let's get this show on the road. So like every other workshop or class that I've done, this is not physical therapy. These are just common pointers and tips that the general population, the general public can use to help unlock their stiff back. So, but if you're dealing with something specific, some aches and pains that you want to get checked out, please consult a medical professional, maybe go to a physical therapist because we are movement specialists. All right. So another important note is that when we're going to go through some of the stretches today, we don't want to push through the pain. We want to go gentle and try and hold things for longer periods of time if we're talking about static stretching, or move slowly into ranges of motion that you feel are restricted. Now, one tip is that when you stretch, we want that muscle to relax. And the only way for that muscle to relax and release is to not be so on a high alert with our central nervous system. We have to tap into what we call our parasympathetic nervous system. And the easiest way to do that is to work on your breathing as you're stretching. A 2-second inhale and a 4-second exhale will help relax that muscle and enable you to go into a deeper stretch. So let's just go really quick over the boring parts of what is the spine. It's made up of joints, bones, discs, nerves, muscle, and fascia. It has 3 curves, and these curves allow the forces, it allows to distribute the forces a little bit evenly over the structure, and the discs allow for shock absorption as well. And then we have the spinal cord that runs down the middle and the nerves that go out to the side. So some 3 common causes, we want to really simplify what can cause back pain, are muscle spasms, some type of joint dysfunction, or disc pathology. But that's a very, very simple explanation because pain is very complex. Pain is a complex experience. It's just an electrical signal that comes from one part of your body, goes to your brain has to interpret it as sharp, dull, achy, whatever. Do I need to pay attention to that symptom or not? It can be influenced by a lot of things like your physical status, your position, neurological. How stressed are you? Like, what's the position, or where are you? A lot of times, if you're, like, one example that I like to use is that if you're walking down a very dark alley and you're an unknown part of town and you can't see very well, your whole body is in a heightened state of awareness, right? So you're always listening and looking for things and looking for threats. That's like your central nervous system when you're under stress or have pain, versus when you're on vacation and you're lying on a beach and you're relaxing, you're really not paying attention to a lot of your surroundings. You're just hanging out and relaxing. So that's sort of like our parasympathetic nervous system, our rest and digest side, where we don't really realize or pay attention to any threats or any pains that happen to us. So pain is complex, and there's a lot of factors that can influence the intensity and basically if you have it. So generally, when people go for treatment, they kind of just think about like, all right, I need this to get rid of my pain, right? But if we can reduce the pain, that's just one step. Sometimes the pain comes back because we don't address the causes. So we have like different things like chiropractic, surgery, you have massage, you have exercise. No one treatment is the answer because our body is a system of systems, right? We have the neurological system, the integumentary system, your skin, You have joints, muscles, fascia, all this stuff that has to play well together in order for us to maintain our ability to function in society and provide for our family. So I think when we're looking at dealing with back pain and how to treat and keep it away, we have to keep a lot of things in focus here. We just don't want to just go for a massage because that only addresses the pain. We want to be able to move through a joint and also be strong and flexible so that our body can take advantage of our new range of motion and use it properly. So when we're looking at pain, we also want to take into account what makes the pain worse. What activities or positions make the pain worse? Sitting, standing, bending, lifting, right? And we also want to take into account what makes it better. Lying down, sitting, stretching, walking. This will drive what types of exercises and what drills you can do to make your pain go away. You know, we look at activities, positions, postures, plug all that into our hypothesis, our treatment plan, and we figure out what are your directional preferences, what direction or position feels better, what direction or position feels worse, and then we look at movement restrictions. Okay, so this is a short, quick video of how the body functions. It functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. So this is what it looks like if we just kind of pause the video here. If we're looking at the lower back, our main focus is that that part should be stable. A lot of times when our body reverses the role, when the back becomes unstable, it's because your thoracic spine, your mid-back, or your hip becomes tight or less mobile. So your body is trying to look for compensations or make up for the lost range of motion, so they'll make the lower back unstable. So let's look at some exercises to help fix your back. So these are the 3 tricks, 3 secrets that will address any tight backs that you might have. Oh, before we get into that, I have to tell you that, you know, everyone, this is part of my philosophy of treatment, everyone should be able to perform some type of self-maintenance on their body to maintain how they can live through life. Sort of like if you have a vehicle, you have a car, you should know how to put gas in the tank, know which side the gas cap is on, how to put air in the tires, simple things to maintain the function of your vehicle. Otherwise, if you have a transmission problem or something breaks inside electronic, you take it to an expert, you take it to a mechanic. So you should be able to know simple things to take care of your body, but then if there is something going wrong that you can't take care of yourself, then go to a specialist. All right, so our first thing that I want to go through is this half kneeling hip flexor stretch. All right, so I'm going to pull this up here. So the reason why we're going to go into this half kneeling hip flexor stretch is because that we talked about the hip, we talked about the back. The back needs to be stable. The main thing that gets us into a standing position or getting up out of a chair or squatting is going to be, I'm going to show you from this angle here, is going to be my hip. All right. So if I'm, say, for example, getting up out of a chair, I have to extend my hip, be able to open the front side of my hip using my glutes. A lot of times, if our glutes are inhibited because we're so tight in the front part of the hip, as we go to stand or bend or pick something up, we run into a roadblock here and then try and borrow from our back. So then we wind up going like this. And then we overextend through the back. The lower back muscles work too hard and they get super tight. So we have to open up the hips to make sure that we can move through the hips and not compensate moving through the back. So to do this stretch, we basically get into this half kneeling position. You can put a cushion or a pillow underneath your knee to make it more comfortable. The muscle that we're targeting is the hip flexor. It's called your psoas muscle or iliopsoas muscle as it combines with the iliacus muscle. It starts on your lower back. It dives down through the abdominal cavity and inserts into the front part of your hip here. So it crosses a lot of joints. The only way to stretch this out is to make sure that the attachment points, the beginning and end of that muscle, are as stable as possible. So the first thing we want to do is when we're in this position, we want to contract or squeeze or flex the glute muscle. So this butt muscle right here, I want you to squeeze that nice and tight. Once you get that tight, what it does is take your pelvis and it tilts it posteriorly. It takes the pelvis and rotates it backwards, tucks your tailbone underneath you. And then the next step is to maintain a rigid or engaged core. The abdominals through here can't be loose because we don't want the lower back to hyperextend. So once we have these two muscle groups on, we're going to translate or move our hip forward gently. As we go forward, you should start to feel the stretch down the front part of your thigh here and maybe into the pocket area of your hip. And as you get into this position, we're going to hold that for 30 seconds. So again, remember that as you stretch, we want to be able to breathe through it. 2 seconds inhale, 4 seconds exhale. As we contract these muscles, maintaining tension at the beginning and the end of the muscle, and then stretch those 2 points apart. Okay, so that's our first one, this half kneeling hip flexor stretch. Let me see here if I could pull up the second one. The second one is going to be this cat camel to child's pose or cobra. What this is going to do is introduce motion to your spine. Our lower back is designed to flex and it's designed to extend. It can side bend as well. It's really good at side bending. It's really good at extending and flexing. It doesn't like to rotate. The lower back isn't designed to rotate a lot. It's the hips and the mid back are designed to rotate. So if you're losing rotation at the hips or missing rotation at the mid back, the thoracic spine, that's when the lower back tends to rotate too much. So we want to introduce pain-free range of motion into the spine. So to do that, we get into this this quadruped position where your hands are below your shoulders and your knees are below your hips. Okay, and then from this position, we're just going to flex and extend the spine. We're going to round out the back and then sag the back. We want the motion, if we're concerned about the lower back, to come mostly from the hips and the pelvis. So as I come into this position, you can see that my pelvis has rotated back, tucked my tailbone underneath me, using my abdominals, my back has flattened, and then if I let that relax, my tailbone tilts up, my pelvis rotates forward, and my lower back extends, right? A lot of times people will compensate and just get through the shoulders and try and do it this way through the upper body. We want to be able to isolate the lower body from the upper body, or the lower trunk from the upper trunk. So using the abdominals and squeezing the glutes, we're going to get into this top position, and then we relax those and then go to our bottom position. The range of motion that you can go through has to be pain-free. Listen to your body and do what you can do. As you do it more and more, initially, it might be a little bit more uncomfortable. But the more that you do it, the less pain or discomfort you should feel, and the more that you should feel like you're getting your back to be loosened up. So once we get into this position, if we feel like we have good range of motion and our back is loosening up, then we increase the range of motion. We go into this child pose cobra, which is coming down, bringing my hips down to my hips, sliding my hands forward, and I'm really rounding out my back here. So I'm flexing through the spine, elongating all the tissue in my lower back here. I could place my head on the floor. This is kind of borrowed from yoga. And this is the fully flexed position. And then I can come up and then go into a cobra position where I just walk my hands forward, reposition, and then bring my hips up and then down into this position. So I'm arching my back now, extending through the lumbar spine, getting that stretch, and then reversing, coming into that. So you can see how the range of motion is much larger than the cat camel exercise, but still the rules apply that we want to go through these slowly and go through a range of motion that's comfortable. I don't want you to kind of force this, and if it starts to hurt and hurts right here and you can't go any farther, just go to there, be comfortable, and then walk your hands forward to get into the cobra. And again, if you're tight through the hips, you'll notice that you can't get your pelvis to the floor, you can't open up the front part of your hips. So again, just go through what you can tolerate and then come out of that. If this is too much, then we're just going to downgrade it back down into the the cobra. What do you call this? The cat camel. There you go. So the cat camel. All right. The next one, if the back is super tight, then we're going to go into a self-trigger point release. So the muscles in the back, we have the paraspinal muscles, which run up either side of your spine. We'll use a ball, like a tennis ball, a cross ball or something, to put it right on that area, right? So if this is my spine right through the middle, I'm going to take this ball and put it just to the side. So it's above my hip bone, below my ribs, above my hip bone, pelvic bone, below my ribs. It's somewhere in this area. That's where the paraspinals and your other muscle called the quadratus lumborum is. We're going to place that there, and I'm going to lie down on my back. All right. So again, initially, when you first get into this position, your body's going to want to tense up because of that force of the ball. What you'll have to work on is, again, gently putting more weight on there, right? So I might roll to my right as I put this on my left lower back. I'm going to roll off of it and then maybe roll onto it gently, working on my breathing, 2 seconds in, 4 seconds out, and then gradually increase some weight on there by bringing my left knee out. As I bring my left hip out, that's going to apply more pressure through that trigger point and the ball, and then you're going to bring that back in. You could certainly start to move your body. If you want to move your body and roll over that ball, that's fine. But once you find a trigger point, once you find a tender spot, and it's not on the bone, it's on the muscle, on the meat, you want to just be able to kind of gradually increase the pressure on there by rolling that hip out. And then the next piece is increasing it by bringing the knee in. So if you bring your knee in and hug your knee into your chest, that'll increase that pressure on the ball. And again, tack down the muscle and then stretch it as you're pulling your knee in. So that's our self-trigger point release. I usually recommend people to do that for 2 minutes if they're going to do that. All right, so let's get back into my full screen here. All right, so the key to preventing recurring back pain is basically, how do we prevent your lower back pain from coming back? Once we figure out your directional preference, we're just going to keep doing it. So we have the cat camel, we did the cobra, we did the child's pose. So we want to be able to repeat the direction that makes it feel better. So it's either bending or extending. You kind of look at it when you go into that cat camel, which direction felt better to you, which reduced the low back pain over, say, 10 reps. If you do something 10 times, does it make the back pain feel better? And then you just keep doing it. Think about it like a medication. Every hour, you're going to take this medication, or once a day, you're going to take this pill. This is the same thing. You're going to do these exercises, either bending, child's pose, or on your back in this position here. The guy's pulling both knees into his chest. It's the same position as doing the child's pose, except on your back, that's basically a flexion position. And then the extension, that cobra. You pick one, you keep doing it 10 reps and multiple times a day to address your back pain. All right, I'm going to put this link in the chat here. This is basically, if you want more information, this is a free ebook. You can sign up to get this online at this website, and that should help give you a little bit more information, more about what we talked about today, and more stuff. All right, so I hope you guys found this session informational and helpful.